Welcome to our recording of our research event on intergenerational practice. This event brought together two presentations, as well as lots of opportunity for peer learning and networking. We have purposely only recorded the presentations and also the Q&A section at the end, which was really interesting, and we do encourage you to watch the whole video as our attendees raised some really great points. We have also taken on board everything that was referenced in the presentation. So, as you will witness, our researchers make reference to different resources. I have since sourced them and added them to the delegate pack. So please do see the descriptor of this video on YouTube for a link to the delegate pack, which anyone can now access. And this will give you a copy of the presentation slides, speaker bios, as well as anything else that was referenced in the event. We hope you enjoy the recording. And if you do have any questions at any point, please note that the researchers do have their email addresses on their presentation slides, but you're also welcome to get in contact with me anytime. I'm Victoria. Email address is victoria@befriending.co.uk.
That's me. Right. So thank you, everyone. Thanks especially to Victoria for the invitation to share the research that I've been involved in with obviously my colleague Alan Gow, who's also here today, on intergenerational engagement and the potential health and well-being impacts on older adult volunteers. So just a bit of background, because the research that we carried out was very much inspired from theory, kind of building from kind of more general ideas about what kinds of activities could potentially benefit our health and well-being as we age. So what I've got on the slide here is a few different kinds of activities or ways that we can engage throughout our daily lives. And I just wanted you to have a think about to what extent do you engage in these ways in your daily life, okay? So first of all, getting together with different people, whether that's family, friends, or kind of established networks or groups that you might be a member of. So we think this is something that can be good for us as we age, especially because being isolated and lonely is something that we believe is a risk factor for kind of cognitive impairment and dementia potentially as we age. So basically having social interaction is something that we believe should be good for us as we age, and obviously a way of enjoying life that bit more if we're among others. Another way we can engage is cognitively or using our thinking skills. So to what extent are we engaged? To what extent are we learning new things and problem solving, either on a daily basis or at least a number of times in a given week? Maybe after we stop working, it might be something that we notice that we don't do this as much as we used to. And certainly kind of cognitive stimulation, stimulating the brain and sort of flexing those mental muscles is something that we believe that also can be good for our brain health and our brain functioning as we age. And then finally, physical activity. So again, lack of physical activity is believed to be a risk factor for poorer health outcomes as we age. And I should say at this point, of course, that I am coming at this from very much a brain health bias, and I'm sure Alan would agree with me there. Our initial interest in this topic was very much fueled to looking at how can we preserve slow or delay cognitive impairments as we age. And this is what got us really interested in sort of the everyday activities that people carry out and how they might benefit us as we age. So with physical activity, if we're keeping more physically active, we're getting the blood pumping, then that can benefit our cardiovascular health, which we believe can then have impacts positively on our brain health and functioning as well. So essentially then we believe that there are health benefits of social, intellectual and physical engagement as we age. And this is something as well that's recently been, these are 3 of many potential risk factors that have been identified recently for cognitive impairment and dementia, which I say Alan and I are particularly interested in. But there are different ways in terms of trying to gather evidence for the effects of these types of engagement. There are obviously different ways in which we can go about trying to understand the effects that these engagements can have. So what we can do, of course, we could bring people into a kind of university setting. We can run sometimes quite artificial kinds of programs, like whether it's certain types of mental engagement or stimulation that we want to look at the impacts of these. And that's fantastic because it's really important to do those very kinds of controlled pieces of research to try to understand the impacts, especially of very particular kinds of engagement and what the health impacts might be. But the other thing is, you know, just as I've got on the images there, the everyday forms of this kind of engagement should be important too. And in fact, they might be more important because it's how we're spending our lives kind of day in, day out. So, and what we could call as more everyday forms of engagement or real world engagement, like getting together intergenerationally and doing different activities that might be of interest and enjoyable by the different generations, could be a type of everyday activity that is quite holistic by increasing all of these kinds of activities that we engage in any given week. So it might tap into the social, the intellectual, and the physical stimulation that might be a great recipe for our brain health and our health more generally. So thinking specifically then about intergenerational practice, so this might be one example in which we can try to stimulate ourselves in these different ways as we age. And as it happens, aging is often accompanied by a desire to be needed and to give back to younger generations. It's obviously important to bear in mind that as we age, there's lots of fantastic things that come with that. Often aging gets a bad rep because we often hear about the more negative side or the potentially negative sides of aging. But actually, if we think about as we age, we have wisdom, we have lots of life experience that we can benefit from ourselves, but we can also impart onto others. And theoretically, people typically do feel that they want to pass that experience on to younger generations as they age. And intergenerational engagement usually should involve some kind of context that's of mutual benefit for the different generations that are involved. So while I've just said that older people have something that they can give back to younger generations, likewise, there should be something that older people can get out of such engagement as well. But it's important to bear in mind that really these kinds of programmes can involve quite a variety of different age groups, contexts, activities. But as I say, the key binding factor of all this is that it should bring people together, that they can both get something out of it, you know? So something that we can all benefit from. The specific context should vary according to what are the aims of the project. And that's something that's important. I think if anyone here, for example, was thinking about starting up a new intergenerational programme in their local community, well, it'd be important to start out by thinking what actually are the aims of this project? What are we looking to get out of it? And that could then dictate exactly what would be the context, exactly what would be the activity or the range of activities that would be involved in the programme. But I guess the main piece of research that we're going to share today really came from a recognition in Alan and I and other researchers in the community that really we need stronger evidence about the health outcomes of this kind of engagement. It's fantastic that there are so many different intergenerational engagement programmes that exist these days, and I think the number definitely has increased in the last kind of 5-10 years or so, which is fantastic news. And we do think that we have some evidence that it can be beneficial, but we do need to keep building that evidence base, and we need to be clear of what we are quite confident about in terms of what are the health outcomes and also what other research is needed. And that was kind of the context of our work. One of our key bits of inspiration was on the US-based Experience Corps programme, which you may have heard of. This is a programme which aims to benefit older adults' health and well-being, along with schools, social and academic outcomes. It's an extremely successful programme. So, for example, in the last academic year, there were about 1,300 highly trained volunteers, aged 50 plus, working across 18 communities in the United States, and they were helping about 4,000 children in that 1 year alone. And before I go any further, I do want to give an important mention to Dr. Anna Czakowska, who's in the bottom left of the screen there with me when we actually had the valuable opportunity to go and visit the Experience Core programme in Baltimore in the States. This was, we did this work in the context of Anna's PhD, and so we had this great opportunity to go and learn from one of the gold standard programmes that really takes place globally. And so Anna really drove all of the work that I'm going to present today. But this programme alone has provided evidence that older adults' thinking skills and brain health can benefit from engaging in this way, so going into the schools and supporting the young children. And also they gain social support, so they gain networks by joining this programme. But it's not just about the benefits for older people, also the school climate and the school learning environment also benefits from the older adult volunteers coming into the school. So when Anna was starting out with her PhD, what we wanted to do to begin with was to say, right, what evidence currently exists? Because we wanted to identify for our own original research that we carried out what would be useful to do, basically. But the first thing that we did then was to carry out a systematic review on the topic. And that was a case of comprehensively trying to bring together all of the evidence that exists specifically about the older adults' health outcomes of participating in any kind of community-based intergenerational engagement programme. So we're looking at the thinking skills, the social interactions and networks that can benefit in the wider health and well-being factors as well, and how these might, what evidence exists in terms of how these might benefit from engagement. We registered our protocol for our systematic review on Prospero, which is a marker of review quality. And we also carried out our review following the Centre for Reviews and Disseminations guidelines for undertaking these kinds of reviews in healthcare. So that just meant that we went very much through a systematic series of steps. There were various checks and markers of quality in terms of how we conducted the review to make sure that we're really giving ourselves the best chance of bringing together all of the available evidence that was relevant. Now, I've got a diagram on the screen here, which is what we call the Prisma flow diagram. Now, I don't want you to take in all of these details, but all I want you to see is when we filtered through all of the available evidence, so and what kind of came out of that. So when we initially searched all of the databases for existing relevant research, we found over 13,000 records initially. And we went through various steps, whittling down those papers to find exactly what is the available evidence here that's relevant to our review. And then eventually, as you see at the bottom here, we found that there were 44 studies and 47 records of evidence resulting from these 44 studies that were available to include in our review. Importantly, as part of the process, we also assessed the quality of each of the included studies using a published tool for doing so, because it's important that we look at each bit of evidence and assess its quality when we're making our overall conclusions. So there were a mixed range of kinds of studies within those ones that were included. The majority, 26 studies, were quantitative, so they took some kind of measure of health and then looked at how that might have possibly changed from people participating in an intergenerational programme. However, there was also a few qualitative studies, meaning things like focus groups or interviews to actually ask people about their experiences and perceptions of these kinds of programmes. And there were also 14 what we call mixed method studies. So that's studies where they took both kinds of evidence into account. So they took some measures as well as asking people what they thought and so on. So a nice mix of available evidence. The participants included in the review overall were aged 50 to 100. They were mostly healthy older adults, although 2 studies included those with mild cognitive impairment. And the studies comprised quite a varied range of a number of individual participants in themselves. So one study comprised only 6 participants. That was probably qualitative research that's more appropriate for that. Up to over 700 participants. It just shows really the varied nature of the existing evidence. The programmes varied as well in their content, so it might be older and younger people coming together to play great games or crafts, share stories. It might have been more physical activity based, things like mentoring as well. And the context varied too, so it was always community based somehow, but it might have been a school, a university, a community centre. So again, it just depended what the context and the aims were. Any one programme varied greatly in duration too. So one programme was just 1 week long, whereas others went as long as 7 years. Any one session within the programme could have been as short as 15 minutes or up to nearly 8 hours for a particular session. So again, it really shows there's quite a bit of variation in these programmes. Now, we grouped the evidence according to whether it was looking at thinking skills, social interaction, or kind of wider health and well-being outcomes. 4 of 8 studies found significant benefits for thinking skills, and the kinds of measures that were included there were things like our attention skills, our memory functioning, or the level of cognitive engagement, that's how mentally active is someone kind of in their everyday lives. Then looking at health and well-being, so measures here were things like depression, anxiety, loneliness, physical functioning. And 21 out of 31 studies there found a significant benefit somehow. And then finally, for our social functioning, 15 of 24 studies found a significant benefit. So that's things like generativity. To what extent do people feel that they're actually giving back to the younger generation? What are their kind of attitudes like towards the younger generation? So again, so really a lot of evidence, but the majority of it in general was finding some significant benefits. But important, of course, to highlight that not every study was finding a benefit either. Some were observing no change. So to summarise then, we did identify potential benefits of this wide variety of intergenerational engagement programmes. The most notable and most robust findings were for anxiety. So all 3 studies that looked at that found a benefit. The social factors like generativity and cross-age attitudes and perceptions, again, the majority of studies looking at those found benefits. Then for physical activity, again here, 4 out of 5 quantitative measures showed some benefit, okay? So important again to highlight the heterogeneity, so the varied nature of the programme context of the different kind of individual studies designs, the dosage of the intervention, so how much engagement are people having from the programme and so on. And so we do need more high quality, similar evidence to emerge over the coming years. So only 11 studies out of the 44 that were included actually met the criteria for what we call high quality. So it was the highest quality kind of research that we would want in order to feel really confident about our conclusions. There were also limited studies addressing the impact of intergenerational engagement on our thinking skills in particular. And hence we were coming from that bias to start off with. So we went ahead and actually carried out a pilot study, which we called Generation for Generation, to then start to develop, not only establish a programme in Scotland, but to begin testing what potential benefits could come from that. So I'm just going to summarise this really quickly. But as I said to Victoria when I first joined her this afternoon, it might be an idea for us to come back and speak about this in more detail in a future research meeting. But I'll just summarise really briefly what we did. We had older adult volunteers come into some primary schools in the West Lothian region of Scotland. We carried out protecting vulnerable groups checks and checked their health, that they were able to come into the schools, and looked at their cognitive, their physical and their psychosocial well-being at that time when they first joined the study. Then half of the participants were assigned to a control group where they didn't get assigned to a school, and the other half went ahead and joined a local school. And there, what they were asked to do was to join the school for 6 months to support the young children's sort of their academic attainment, basically, so to help them reading, with their numeracy and things. And they would do that for 8 hours a week for 6 months. After 3 months, we got them in to look at their cognitive, physical and psychosocial functioning again, and then the same after 6 months of the duration. At the end, we also collected some nice qualitative research, like in the form of focus groups and diaries of the older adult volunteers, and basically asking them about their experiences and their perceptions, because we thought this would be really important to supplement these measures that we also took. Okay. And just to really highlight some of the key findings, we found that 3 of the 5 thinking skills measures that we took actually benefited from the intervention. So this is just one example here. This is short-term memory. And what we see here is that these are the people in the control group where they weren't assigned to the schools and the sort of dashed line here. So you can see that's basically quite flat, that there wasn't much change over time. Whereas with the other line, you can see those who went into the schools showed a significant improvement from when they first started the programme to after 3 months. And then this was maintained at the 6-month time point. And there were 2 other measures that showed a similar kind of change over time for thinking skills. We also found some other measures around general health and well-being. People reported being less sleepy during the day if they were in the intervention. They reported feeling a greater sense of generative achievement, giving back to the young people, and more positive attitudes towards the younger people. We did take many other measures, of course, that didn't show any change, but because this was a very small scale study, we were really quite excited by these, and we are in the process of writing up and finalising this set of findings. I just wanted to finish with the words of some of our older adult participants, because when we did the focus groups, we found a number of key themes, like, for example, what were the motivators for them joining in the first place. So one participant said, I thought it looked really interesting, and I thought, yeah, I've got lots of time and I've got a lot to give. So that's that generativity bit there. And we've got life experiences, you can pass them on to the children. Okay, so that was one of the motivators for joining. Also, in terms of a reinforcer for continuing to engage once they joined, one older adult said it was the best days of the week. You know, how amazing is that? Another person said it prevented 2 pyjama days. So this just shows how a community-based intergenerational engagement programme can really have impacts in the older adults who volunteer and stick with it. So just to summarise then, our systematic review showed a range of potential health benefits for older adults who participate in intergenerational engagement programmes. And we do need more high quality research though, and particularly more research on cognitive outcomes, because there wasn't as much of that to begin with. Our own pilot trial also shows some nice promise. So people typically improve after 3 months, and the measures where we see change, and further engagement maintains those levels. So it's really quite exciting there. But we have to treat those preliminary results with caution, because we have to now go ahead and do a full higher powered trial. But do watch this space for preprints of our reports, and hopefully we'll come back at some point to present those findings in more detail for you. Just to acknowledge all of the investigators who were involved in the project, especially Anna again, who completed this project for her PhD, and special thanks to our volunteers, West Lothian Council, schools, teachers and pupils, and Generations working together, who also helped us to recruit some schools to the programme. Finally, before I stop, I do have my email address on the screen. If anyone has any questions, then please do get in touch. Also, we couldn't do our research here at Strathclyde Uni without people participating. So if any one of you have any networks or groups where you could share our call for research participants, because we always have research going on all the time, basically, then please also get in touch, because we'd love to share some text that could be included in any newsletters or announcements at participant groups, for example. So thank you very much for your time, and I'll stop sharing my slides.
Thank you
Over
so
to you,
much,
Victoria.
Louise. Thank
Great, thanks, Vicky. I'm just going to share the slides, and I think Joe's going to start with our introduction.
Okay, so while the slides are appearing, hello everybody. It's amazing to be here. Thank you for the invitation. I'm Jo Thompson-Kuhn, and here with Rebecca, or Becky. We're from the University of Exeter, and we're going to be talking about some work that we did over a few years, and it's with quite a big team based in Sheffield and Exeter. I'm going to maybe pass straight to Becky, and she can tell you. Am I doing this right, Becky? This is a problem with having two presenters, and we can't even be in the same room. So what we're going to do is we're going to give a bit of a summary of what we've been doing. We're going to talk about, and it is quite similar to the previous presentation, but hopefully it will be interesting. And we're going to talk a little bit about the benefits of intergenerational practice. We're going to share some resources, and then obviously there'll be time for questions at the end. So I think now is the moment I pass to Becky.
Thank you, Jo. Yes, so actually we received some funding, or we applied for funding from the NIHR, National Institute of Health Research Evidence Synthesis Programme, to conduct some research which was initially to create an evidence gap map to basically try and house all of the research that had been done on intergenerational practice in one place. One of the reasons for doing that was so there was a resource for anybody that would be interested or could use that information to just find it a bit more easily. So in this project, we worked with quite a big group of different types of people. So we did have academics from 2 or 3 other universities. We also worked with the Centre for Ageing Better, Age UK, some public health practitioners from and some local authorities who are also working with children in their areas. And what we found was, what we produced was this evidence gap map. And I'm going to show a picture of that now. And what it looks like is not a geographical map of activities, but it's more like a table. And across the top, in case it's across the top, we have the outcomes that we were interested in. So we have outcomes for young people in terms of whether these studies are reporting outcomes about attainment or knowledge, mental health, agency, mental well-being, loneliness, and socialization and attitudes, and so on. And then we have those outcomes duplicated for older people as well. And then further along, which you can't see in this table, are other outcomes that were identified as being of interest. So outcomes related to the people who are working not directly impacted by the intergenerational activity itself, but maybe parents or carers and those working with those people. Also outcomes around economics, so how much these programs cost, and also what kind of things are preventing them or helping them to be implemented, and what kind of adverse events we might find in the research. And on the left-hand side of the table is a way that we've tried to categorize these intergenerational practices. And we've used a scale that's called the levels of intergenerational engagement, which was created by an author called Kaplan. And the idea is that you can kind of categorize intergenerational interventions into how much intergenerational engagement they have. So at level 1, these would be activities where the older people and younger people don't actually have any contact with each other. They're just learning about each other. And then for activities that would be at level 4, for example, those are activities where there is some interaction between the two groups, but it might be just one-off events, or maybe meeting at Easter time for a special event, or at Christmas time, children going into a nursing home, for example, to sing Christmas carols or do Christmas craft. Then we have interventions at the level 5 and level 6, which are those practices that are happening more regularly with the same, not necessarily the same people, but the same organizations, coming together maybe weekly or monthly to spend time together doing a specific activity or task that's meaningful to them. And then at level 7, those are activities that are actually just part of everyday life. So it's an intergenerational way of life where, for example, students might be living with older people in a shared facility, or it might be where a nursery or daycare centre for children is situated on site with a nursing home. And in this map, you can see there are different coloured dots. So the different coloured dots relate to the type of research that's in that area. So for example, in the first box in level 5, there's a big orange dot, which suggests that there's quite a lot of qualitative studies in this area. And so that's level 5 projects that look at outcomes, or to do young people's outcomes on attainment and knowledge. Then there's the smaller light blue kind of dot, which is looking at comparative intervention studies. That's quantitative studies, but they're not RCTs. The green dots are RCTs, and mostly those green dots are very small throughout the map. And then we have a darker blue circle, which is observational studies, and then a kind of purpley kind of circle, which reports the studies that have used both quantitative and qualitative methods in their studies. So what we have in this map is about 574 different types of research. So it was kind of a lot more than we were expecting to find. And it's a very varied group of research studies. So there's the studies are coming from over 30 different countries. There's 34 systematic reviews in this map. There are 270 quantitative studies, and of those 39 are randomized control trials. There's over 275 qualitative studies. So like you were saying, Victoria, that's something that we really is a strength in intergenerational research. And the studies that we found also are being set up in different settings. So there's assisted living settings, care home settings, those that are conducted in community, like in church halls or community halls, those that are conducted in school, in higher education, or in shared facilities. And we've tried to make the map so that we can filter those studies based on some key information. So if you were looking for studies, for example, which host intergenerational activities with children who are aged 0 to 5, you would be able to select the 0 to 5 filter and find the studies that talk about those children or interventions that have engaged with those children. And similarly, you can do that for the other age groups, which are 6 to 12, 12 to 18, and 19 to 30. So we had quite an older age range that we were including. There's also a massive range of activities that are happening in these intergenerational interventions, and you can also filter with the research through those activities, which are similar to what Louise mentioned earlier: arts and crafts, cooking, dance and exercise, gardening, drama, learning skills together. That comes up quite a few times, or working on specific projects. Then there's professional education, which is where students at university or college who are learning to be working with older people might come and spend time with older people, learning about them more practically. And then there's different activities like just actually sharing time together, sharing a meal, playing games, sharing stories, and also those where they are living together. We wanted to try and capture if any of this research actually focused or targeted specific personal characteristics of the older people or younger people. And there are some, but it's quite few. So there's a few studies that specifically target older people with cognitive impairment, for example. There's about 58 of those. And there's a few studies that might target populations who are in low socioeconomic status areas. So we just, so this is kind of an overview of the map of where all of this research, not quite to date, so that it's most recently updated in November last year, where you'll be able to find it if you were interested. The other important thing that this map does is in the boxes where there are no circles and no coloured dots, that means there's actually no research on that yet. And there are quite a few areas of gaps. And one of the key ones we've noticed from the map that people in this area are interested in is the impact on community and what that community impact actually means and how we measure it. We also don't know much about how the interventions impact the people surrounding the activities, the costs, all the adverse experiences, and to some extent we don't actually know very much about how the mental health and well-being of children are impacted. So after we created this map, we conducted 2 reviews, one very similar to Louise's review, and in terms of looking at the mental health and well-being on older people. And the second review is looking at exactly the same, but for the outcomes on children and younger people. So for this, we decided to look specifically at randomized controlled trials. And we found that I'll try and get my words out. We found that actually often the trials aren't reporting on both populations. They might be reporting mainly on outcomes for older people, or they're reporting on outcomes for children and young people. And actually there's much more literature that's reporting on the outcomes for older people. So there were 16 studies, randomized control trials, looking at older people's outcomes, and 5 on younger people's outcomes. As Louise mentioned, we know that the quality of that evidence is often actually quite poor, and what we can really do with some more high quality research, but we know that that is really tricky, especially in this field. And I guess the variety that we see in the map is just coming through in those reviews as well. So we had mostly the intergenerational activities are in person, though sometimes they are online. They're also happening in different locations. So often they're happening in schools and care homes and in assisted living, but there are also sometimes activities happening in hospital and in shared facilities. And there's a massive range of activities that are actually happening, as I mentioned earlier. And in terms of where these research studies are happening, they're happening. There were 11 trials happened in America, and then only a few in other countries. So 1 each in either Canada, Japan, Germany, and Australia. And 1 study was conducted in Italy and Spain. So there's just a massive variety of research, and I think Jo is going to talk a bit more about the outcomes. And I'll try and show a slide.
Mm-hmm. Okay, so I think if we go on to the next slide, so just thinking a little bit more about the systematic reviews, which Louise gave us a really good kind of explanation of what we're doing in a systematic review. So I'm not going to talk more about that, but just to talk a bit more about what the reviews found in terms of the outcomes. So in practice, you'll be observing in your practice, and we heard from lots and lots of intergenerational practitioners that they observe many benefits as a result of intergenerational interactions, things like reduced feeling of loneliness and isolation, greater happiness, engagement in activities, more interesting connections with people, either in their generation or in the other generation. People they may engaging with people they may not normally get to see, and their peers around them, positive feelings of self-worth, self-esteem, confidence, social skills, and meaningful, sometimes long-lasting relationships and connections that really make a difference to the lives of the individuals and groups involved. And that's something that Louise also talked about at the start. And also those benefits are often seen in the staff as well, so teachers and or carers or care home managers and families. So we've heard lots of, while we were doing our work, we had lots of stories about how, having an intergenerational activity within a care home gave maybe the residents something different to talk to with their family member when they came to visit. So the impacts are really wide-ranging. But in a systematic review, we can only report on the outcomes that have been measured in the studies. And so it is quite limited. And that might be because it's quite difficult to measure some of those things that we observe. It's quite difficult to measure somebody, or how would you could maybe describe it qualitatively. It's quite difficult to describe it in a numbers way, like whether people are engaging more or better with other people. So in the systematic reviews, in the older people systematic review, researchers had used 46 different measures of mental health and well-being across the 16 studies that we included. So you might also think, well, that's quite good because that's telling us lots of different things, but it also makes it very, very difficult for us to combine those results across the different studies and to try and work out what's happening across all of the research, because they'll all be measuring something slightly different. And ideally in a systematic review, we would like to kind of pool the results from all the different smaller studies to get an overall result, and it's very difficult to do that when you've got so many different outcomes. But where we were able to pool the results, we did find some statistical benefit of improvements in depression and self-esteem in older people, but not measured in the children. And individual studies indicated some positive improvements in children's well-being, older people's cognitive decline and personal growth. But we do need to be a little bit cautious about interpreting that because it's early results from small studies. For children, the most commonly measured outcomes are related to attitude change or change in knowledge about older people. So that's a very common seems to have been a very common approach for researchers to want to know whether mixing with older people improves their attitudes to older people. And I think generally it does, but it's a funny thing to be so interested in. Quite a lot of the studies, as Becky said, they've involved children and young people in the practice, but they're only really interested in what happens to the older people. They're not really interested in whether it has an impact on the young people. We also, so very, very little on outcomes that for children's benefit themselves, like their behaviours or their mental health or their well-being. Those things have not been measured very often. And one of the things that the intergenerational practitioners that we worked with were really, really interested in, so they were like, so the whole ethos of intergenerational practice is to bring people together for kind of mutual benefit, and yet we don't really measure the impact. Researchers don't really measure the impact on the community. So is the culture in the care home somehow impacted by having the children and the young people working together on a common project? So had lots of lovely projects of, maybe they're producing an artwork or they're producing something together, but there's no measure of whether that has an impact on the kind of the environment or the culture within the care home. I think next slide, Becky. Yeah. So yeah, thinking then, what does this mean for research and practice? So I guess we've talked a lot about considering outcomes for both generations. Also, it would be really helpful for researchers in the future to use accepted tools to measure the outcomes and the same tools. So that's an area that we're thinking about. If there was like kind of an off-the-peg list of tools that you could and should use in an intergenerational evaluation, then we'd get lots of people using similar kind of tools and we'd be able to pool. And yes, considering the theoretical underpinning of the practice. So we know, as Louise explained, some of the theory, some often when people do research, they don't actually explain what theory they're kind of building on. So I think that would also be helpful. Becky, is there anything else you wanted to say on that slide?
No, I think that's right. I think we've just got some key resources that we wanted to share with you. Louise mentioned that they work with generations working together, so they've been a really key in our research and knowledge too. And so we're always in liaison with them and trying to develop new ways of going forward. There's also, so they're based in Scotland, and now newly reformed Gen All. They're I guess what they will hope to be the English equivalent, and they work directly with generations working together as well. And then we've got some just other networks that we connect with who likely run some befriending opportunities, but also more generally intergenerational activities in different places. Yes, and at the bottom there, we do have the Intergenerational Evaluation Toolkit. And this has been developed by Generations United in America, but it is one of the places, I guess, where you could get an idea of some of the outcome measures that you might want to use if you are evaluating your own practice. But there are other options too. I think that's us. Is that right, Jane?
Did you have another slide?
Yeah.
I think there's another one as well with our contact details on.
Yes.
So we are looking for funding for further work, and hopefully we will be able to do something to hopefully fill some of the gaps in the knowledge that we have. And yeah, interested in community outcomes and seeing what we can do to help to get consistency across research studies. I've put a link to the map in the chat. Hopefully that link works. And there's also a little video on our website. I've also put that link in the chat, which talks you through how to use the map. And there's some other resources there as well on the website. I think there's a podcast and some other things if you're interested in work that we did. And then the last slide just has our contact details on it. Thank you. Very happy to take questions now or later.
Yeah, perfect. Thank you. And just to say, the links that have been put in the chat, I can embed them into the delegate pack as well, just to make sure people have access to them. So rather than place people away into breakout rooms again, I think I will just keep us in the main room because we have just got 20 minutes left. So just to ask if there are any questions for either of our speakers. Angie, you got your hand up. Over to you.
Hi guys, my apologies for being late. I had a previous meeting for this one. I'm just curious. I'm sorry I didn't hear the whole presentation. I hope you'll be able to see it later on. I just wondered if you were aware of and had considered John Swinton's work. He did quite a lot of intergenerational work between Scotland and Australia. And he is a lecturer, senior lecturer at Aberdeen University, a good friend of mine, and he's done some real pioneering work in relation to intergenerational work, particularly looking at care home provision and how we can improve the experience of care homes using something similar to the Australian model. And he writes from a theological point of view, unfortunately, it's not unfortunately, because actually spiritual is just as important, but it is quite an interesting piece of what he's doing. He's written lots of work on old age. That's his speciality. He's a mental health nurse initially who worked in old age care, and he is one of the leading researchers and speakers on old age provision and intergenerational work within the universities in America, Australia, and Aberdeen. I just wondered if you'd heard of him.
Thank you, Angie. Either of our four researchers aware?
If you haven't heard of him, happy to talk to him and see if he can reach out to talk to you if you're interested.
Thanks, Angie, for raising that. I've made a note of the name in the context, the care home context. It sounds fascinating. I wasn't personally aware of that exact line of research, but actually I think your question really highlights how broad and varied intergenerational research is, because there's so many different contexts, specific subgroups that that are important to look at. So the work that Alan and I did was looking at healthy older people primarily and how we can slow or prevent any subsequent impairment. But clearly work like that's really important too. We were looking at the care home setting and how can we potentially reverse any declines that might have been experienced.
That was the thing that was significant in his research. So I did his training course last year. What they found was that by introducing measures such as bringing young people into care homes and introducing like cafe style themes into care homes, they reversed dementia and old age decline by up to 15% in people, and people lived on average for 7 years longer than previously, and that was measured using qualitative and quantitative research, using longitudinal studies, and for quite a period of time. It was measured over a period of 15 years. So it's
Wow.
really interesting research, and I'm happy to pass on the stuff that I have from him to you if that would help.
Thank you. I tell you what, Angie, I'll get in contact with you. And what we can do is try and create that connection. And always, if I can find resources again, I can add it to the delegate pack. That's why delegate packs exist.
No problem at all. Thank you.
No problem. We have a question from Nina. It says, when you say that there are gaps in community, what community types are you looking at? I work in the sensory loss for a charity and the sight loss sector, and wondered if there's anything around intergenerational work and disability. I'll just put that to all four of you, if any of you have it.
Yeah, I think that's a really, really good question. I guess what we meant by gaps in community is that we just don't know how to measure like a community and how that works and what's important within that community setting. So it's not that necessarily that particular communities are missing, but just the idea of how you measure that sense of community, either as an individual or as a group. That's what's missing at the moment. But in terms of the second part of your question about particular characteristics of groups, they aren't very often targeted, especially, did you have any particular disabilities in mind? I'll pass them back.
So sensory loss, sight loss, hearing loss.
I would say
with the aging generation, you know, these kinds of disabilities are quite prevalent.
Yeah, I think the only thing I can say is from the map that we produced, those kinds of impairments they're not coming through in the research, as far as we can tell, as in things are not targeted at them. But it might be that they're still involved in the broader activities. It's just, they haven't been specifically targeted as something more appropriate to them.
I guess
I've got the closest thing I've got in mind that's included in our review was some research that took place. I think it was in men's sheds, and it was about more of a mentoring kind of context. So older males mentoring younger males and helping them with self-esteem and so on. And I've got some other ideas, but I don't want to say because I might have misremembered. But actually, I think the point is well made, because that's a context where one could easily imagine that someone who may be having lived with certain disabilities for so long might have really gained a lot of wisdom and experience about how to navigate that, and so therefore lots of tips and ways that they can help younger people who might be navigating similar issues. So that would be another context that I'm sure could benefit from an intergenerational context.
Yeah, I asked just because I'm new to the organisation and I've come in to mobilise this project, and we were looking at how it would run, whether it be mixed ages for the befriendees and mixed ages for the befrienders, and then how that would look and how we would measure and obviously evaluate the outcomes from that and how it's impacted on them as individuals, but then also has it helped them with their confidence and all the things around their disability as well. So I guess it's just adding that extra layer into how we record that through this new project that I was interested in as well.
And just on that, Nina, we know that sensory loss as people get older, so not people who are born deaf or born blind, but people who lose aspects of the hearing and sight as they get older, we know that those increase the risk of memory impairment and dementia. And so any project that targets people with those sight, hearing loss experiences with a view to connecting socially, I think is incredibly important, because there's lots of different reasons why sight loss as we get older might increase the risk of memory impairment. But one of them is because we might start to withdraw socially, or we might be excluded socially from our existing network. So in terms of the underpinning need for the kind of work you're thinking about, it's absolutely critical. So echoing the other folks, not aware of as much of that work going on as there should be, but it's absolutely critical. Hearing loss, sight loss are now, recognised risk factors for memory impairment, dementia, and later life. So anything we can think of as interventions, particularly in earlier stages where people are losing hearing or sight, to try and increase opportunities for engagement, connectivity, etc.
Thank you.
Thank you. We have a really interesting question actually from Fiona, which is something I've often thought myself, because sometimes I can speak to someone just even 5 years younger and feel like I'm from a whole different universe. But how far apart in age do people have to be considered as being in different generations?
I think that's a really good question. For our specific research project, we looked at people who were more than one generation apart, because it's really difficult to quantify. But I guess what we didn't say actually in the evidence gap map is we have not included studies that might have looked at generations from the same family. These were all non-familial intergenerational interventions, and usually I think when we talk about practices that include like I can't think of quite the right words, but a smaller range of the intergenerational. So you might have a mother and a daughter and a grandmother in the same thing. We would call that multi-generational projects. But I mean, I think, yeah, I'll stop before I say something that I can't really qualify.
I would agree that the classic view on it would be that you're looking at so middle-aged and young and middle-aged and older would tend to interact more readily than young and older. And often, if you think about it, families are a lot more displaced these days than they used to be. So there's not as much grandchild interaction as we used to have in days gone by. So that can actually be one huge benefit of intergenerational engagement in that context, where actually people who might be missing out on grandparenting and the young children who might be missing out in grandparents, at least in a more daily kind of context, then it can actually help to, the bonds are actually one of the biggest parts of people continuing to engage in such a programme, because the bonds and the relationships that build from it are what keeps people turning up, basically, and keeps them looking forward to the next session when they get to come together.
In terms of the age sort of part, or the age differences, Fiona, the broad definition of generations are about 20 to 30 years apart in age. And I think that's based on your sort of average familial cycle. It's not exact, and 20 to 30 years is a big gap as well. It's like that's a huge range, but that's the broad definition of what constitutes a generation. So when people say once in a generation, that's generally what they're talking about. You might not see the same thing again for 20 or 30 years. But the sort of statement I think that Victoria made as she was sort of transitioning into that question of, you could actually have people who are much closer together in terms of age than that, but could end up interacting as if they were from different generations. And I guess you get into an interesting discussion then of, is it really generational difference, or is it just people coming from different experiential perspectives? And it's the sharing across those perspectives that's actually what's driving a lot of those opportunities. Because I know that a lot of the work you do within your befriending networks, they won't necessarily be intergenerational befriending opportunities, but what you'll probably always have are people coming from quite distinct, backgrounds, whether that be social backgrounds, educational, the different experiences they've had. So it's an interesting question, but yeah, 20 to 30 years is roughly the generational definition, but it's not exact, and it's not meant to be exact, because obviously there's lots of reasons why a simple time metric, doesn't capture some of the nuance that you might be, considering.
Yeah, and I would come back to that point that I made quite early on, which is around what is the aim. So as Alan says, don't feel too bound by rules or regulation, but what is the aim of the programme if you're looking to set up a new programme? And so quite a few of the programmes included in our review were mentoring type programmes, and so that was often more middle-aged adults with, it could have been actually adolescents or young adults. But again, the point there was that there was some experience and wisdom that could be imparted, and it gave the middle-aged people the opportunity to feel that they were giving back to the younger people.
Yes, Fiona.
Well, I just want to say that the befriending that I run is cross-cultural, and I connect local people with new Scots, so refugees and asylum seekers, and maybe there's a whole other branch of science that is investigating the impact of cross-cultural interactions, and that would be very interesting.
Definitely. It's such an interesting topic. We've actually even got more questions. Nicola, I'll come to you second. Just a quick whip round for opinions. Celine has asked, is there a country currently that would be considered the best for intergenerational practice or culture? So from all those many, many papers and reviews, is there one country that stands out in your mind?
I mean, lots of countries are coming to mind. I'm not sure that I would pick out any particular one. I mean, I would say that in the US, they really got a lot of this kicking off around the 90s, and so the Experience Corps programme was one of the earliest, and has continued to go, still very active, as I pointed out. But certainly it's inspired work globally, and so like Japan, Australia, there really are examples all around the world. So I can't personally pick out a particular country that's outstanding. I don't know if either Becky or Jo could.
Oh, well, I was going to say Scotland. Generations working together are really doing some groundbreaking work in terms of like quality standards and training. So because they have government funding, I think, so they've been around and they have that stability. And there's Australia as well. There's quite a lot of research going on in Australia, and there's I will forget what maybe is it Australian Intergenerational Practice?
Oh yeah, AIP.
Yeah, AIP. And I think there's also an active group in Spain. So that's where the research is going on. But I think for practice and generations working together are really one of the main organisations.
Interesting, thank you. And Nicola has asked if the Office for National Statistics would consider incorporating more specific intergenerational questions into their work. I don't know if you will have crossed paths with ONS. No. Well, Nicola, it's an interesting point, but there's a
because we have like we'll have the census that's obviously every 10 years, and having worked on that myself about 5 years ago. I don't recall every single question that was asked in the census, but I do feel like there was some sort of leading questions just around like community and how connected people were. But I'm just wondering if that's something that we could push for in the future for the next census, where we actually get, because obviously there is a need for the census for a response rate, and that could capture a lot more people across the UK for sure.
Yes, it's a good point. Let's start lobbying, Nicola.
I mean, yeah, this is a huge task.
Yeah, I think it's a good question, and I think it wouldn't be uncommon to see in some of those surveys, not just the main census, but some of our other family health surveys that different UK governments do. You'll often see questions about familial intergenerational activity, but as we know, that's not the only aspect, and some people won't have that familial intergenerational activity. So I think you're right. If we're thinking about practice and policy, you can't often make recommendations if you don't know what the baseline is to start with. And not just for intergenerational, I work with some creative aging organizations, and the data at population level on how active people are in creative activities is very limited. And I think the same is probably true for intergenerational type interactions beyond a tight family one. So no, absolutely, Nicola, if you're signing up a petition, send it round, and we'll all add our names to after today.
Well, thank you everyone for your time today. Just before we close, please note in the chat, I have shared the delegate pack link again, as well as our evaluation form, as well as our link to future training and events. And I just want to highlight the other free events that are coming up, particularly our volunteer week events. You can register your volunteers for these, but we purposely put the events on Eventbrite so your volunteers can register themselves if they want to come along for an hour on either Tuesday the 3rd or Wednesday the 4th of June and have us thank them for the work that they do and recognise the wonderful impact they are doing as a befriender. Please do share the link with them. It's on our website. We also, even just this week, have our volunteer retainment session on Thursday to again look at how we hold on to our volunteers. But for any of you that are looking for some digital skills, we have our digital skills masterclasses, which are free for our members as well. And it is how-tos on how to use PowerPoint for the likes of volunteer training, Zoom, how to do events like this, Canva, how to create your volunteer recruitment adverts or posters or social media, whatever it may be. And we also have a session on Padlet. So for those of you that have access to Delegate Pack, that is a free resource. Anyone could use it. We do kind of promote it as a good idea for a volunteer hub to hold all your policies and procedures and things. So if you want to come and learn about that, then please do. But we will start to close the event now. So can I just say a big thank you to Louise, Alan, Rebecca and Joe. Thank you very much for your presentations and your time today. And I will upload presentation slides to the delegate pack later, as well as have the recording. But I will let everyone, class dismissed. I'll stay online last in case anyone else has anything else they want to discuss. But otherwise, thank you very much for your time today and participation.
Thanks very much, Victoria, for organising and inviting us.
Yeah, thank you so much.
Thank you. Bye-bye.
Thanks.
Thank you, everyone.
Bye, everyone.